Dr. Chitani, when I got sick in March, I had a over 100-degree fever. Um, they told me you need to have 103 degrees for 3 days straight before we'll test you. So even in mid-March, it was an absolute disaster. Now, as it turned out, I didn't have coronavirus; I had the flu. But I had no idea, and I didn't know if I was, endangering my family, et cetera. And locked me in a room in this house for quite some time, and because I couldn't get tested, it was impossible. But that was March, and now you say March was too late, but I hear you on that night. Of course, you're right. But my God, we're in August now, and we're still. Even Republican governors are saying it's stunning that there's tests that are taking a week, 10 days to get results back, by which time it's way too late. And so, how could we not have the testing fixed already in August? It's just, I can't fathom it. What did we do wrong all the way up to now?
We opened the economy too fast. The reason I say that is because when the Northeast had our big spike, the rest of the country had cases that were low or on the way down, like in areas of California or in Washington State. But that was the time that economies were supposed to stay closed and open in a phased approach so that PPE could be collected, so that testing supplies and reagents and swabs and all these things could be mass produced when the virus should have stayed low throughout the country. Instead, what happened is that the economy opened too quickly in some states, full force ahead, bars opened, indoor dining opened, people having parties. And all of a sudden, as the virus started trickling down into the communities that were really going to suffer from this, all of a sudden now we needed testing at full speed ahead when we should not have had that much of a demand at this point. The whole country should have been down. So this is just a disgrace. And unfortunately, the whole country is suffering because of it. And I hope that if we get a universal masking policy throughout the country, not just 35 areas, so 34 states and the Washington, D.C. If we get masking everywhere and people keep restaurants and bars closed in areas that are in, a lot of infection prevalence right now, that hopefully testing capacity will build up again.
I see, because those two things are related, of course. You have less testing capacity when you have more cases.
And so much demand. There's so much demand for the cases. And now kids and universities are having to shut down because of it. So as an example, my daughter is a sophomore at the University of Pennsylvania, our alma mater, and she found out today that they're not going back. And they can't go back because they can't quarantine all the kids who are going to come in. They cannot even provide the testing capacity because of delays in testing and reagents and turnaround time. So our kids are going to suffer, education is going to suffer, the economy is going to suffer. And I hope we can get back on track soon.
Now, finally, Dr. Chitani, before we let you go, I got to ask the two, of course, questions at the top of everybody's mind. And obviously, this is your best guess at it. But when do you think we get past this new surge of coronavirus and can safely begin to reopen? And then when do you think we'll have not just the vaccine ready, but actually have enough Americans take it so that it goes back to quote unquote normal?
It's a real tough question. Cenk, I was really hoping when we went through this in the Northeast in the spring that by now we would be in some sort of normal. When I look at the map of the United States and I see the Northeast with lower cases now, but I see hotspots in the South and, in the Southwest. And then I see a lot of parts of Middle America that don't have that many cases. And those are the same states that don't have masking policies. I worry that those states are going to be full of COVID when the rest of the areas are starting to get better. And so are we just going to keep doing this? We're going to keep going round and round like this? I really hope not. I really hope not. And I hope that we do have a vaccine, at least one or two or more in the fall. But I think, unfortunately, 2020, I see almost sunk as a year. And I'm hopeful that in 2021 we can get back to some kind of normalcy.
Oh boy, I can't help but ask one more. How about herd immunity? We shouldn't be in a situation where we're close to herd immunity, but I think we might be. So is that partly what happened in the Northeast, and is that likely to happen in places like LA, Texas, Arizona, where it's raging now?
It happened in certain communities in the Northeast. So, for example, there's an area of Queens called Corona, ironically, where the amount of immunity in that population is almost 60 to 70%, I think 68%. It's a very close-knit community. A lot of people live very close to each other. So herd immunity, I believe, exists in that community. But in most of the rest of the Northeast, that's not really true. There may be pockets. New York State, it's about 20%. States like Connecticut, it's lower than that. So we're nowhere close to herd immunity, I think. But I do think if we get herd immunity in some areas that are densely populated, it might help areas of the country that are not as densely populated. And that might be okay with a vaccine as well.
I can't stop asking questions. One, I swear, last one.
Happy to.
And I don't know how much expertise you have in this particular area, but how much protection do T cells afford us, and how much does that affect herd immunity, and how much could that help?
So basically, it's your body having some sort of memory of how to respond to a virus. So, there are 4 coronaviruses at least that circulate regularly and cause the common cold, not the novel coronavirus. But when you get exposed maybe to a coronavirus again, you might have some immunity. So maybe sometimes you don't get as bad of a cold as other times, depending on what you're exposed to. So I think that if you've been exposed to the coronavirus, our hope is that even if your antibodies wane, that you may have some recognition of this virus if you're exposed to it again, and so that you may have immunity. And maybe that way prevent you from bringing it into your household. So maybe that little herd of your own household may be protected. That may be one way to think about it.